Orthodontics is much more than just about straight teeth, and I'm learning all about that with orthodontist Dr. Ron Cohen today. With all of the advances in technology and what you are able to see and do now, the process is not necessarily easier, but perhaps a bit more honed. Today I want to talk about combined orthodontics and orthognathic surgery. That's not easy for me to say. Tell me what that is.
Yeah, you did a great job.
Thank you.
Good.
I think you're mocking me, but okay, we'll keep moving.
Orthodontics, the root word don, which is teeth, dontos is teeth, ortho is movement. Orthognathics, again, movement, but the nath part, the G-N-A-T-H, means bones. Your teeth are supported by bones, your upper jaw and your lower jaw. And in orthodontics, we have the choice of either making the teeth match the bones, or if we have a severe enough difficulty, we can actually move the bones so that the teeth match together better. Orthognathic surgery and orthodontics, the problem that we have is that you can't just move the jaws forward because the teeth have compensated for jaw structures that don't fit together. And so you have to decompensate that. That's why I'm involved with it. And then oral surgeons then take and move the bones so that the teeth fit where they're supposed to.
Wow.
Okay. For people who have really short lower jaws or asymmetric or big Dick Tracy jaws, those kind of things, you know, it's one of the things that people want. They not only want straight teeth, but they want to make sure that it's all in harmony with each other.
Right. I won't call it a big Dick Tracy jaw, but my sister has a jaw that they were going, I mean, the option apparently was to break her jaw and reset it, which she opted against, but it is something that people are willing to do.
Right, exactly. I mean, the way we look, our smiles, the way we perceive ourselves is really most of the battle on self-esteem, and also helps you in your job and helps you in your communications. If you feel good about the way things are, you know, most of our patients that go through orthognathic surgery, other than those that have breathing problems that they just kind of have to from a health standpoint, are not happy with the fact that their face looks differently than what they want it to look like. And I mean, you could say it's cosmetic surgery, but it's really not, because it really does help make the bones line up well so that you have a lot more harmony between everything. So
it's not a necessary procedure in most cases, but a lot of people do opt for it.
Yes, I would say probably about a third of our adults, when they come in, surgery is one of the options that we give them. There are some that you just have no choice, that the bones are so far off that you could never make the teeth fit together if you wanted to. You can make them straighter or make them look a little prettier, but you know, part of what I do, most of what I do, is trying to make things function better. The cosmetic part just kind of comes secondary. If you make them fit, then they usually look good.
Right.
There are some people, though, that all they want to do is make them look good, and then you have to sacrifice the fit. And when that happens, you get more wear, you get fractured teeth, you can have jaw joint difficulties. There's a lot of problems that can develop from not having harmony with the bones and the muscles and the joints and the teeth.
Now, if one does opt for surgery, is that generally covered by insurance?
That is something that's individual for each person. There are a few insurance companies that specifically exclude it unless it's because of an accident. But there are a number of companies who still do include that. You know, it's not a dental problem; it's a bone structure problem.
Right.
But it really depends upon what the health insurance contract is.
So, how do you go about facilitating quick and good results with the surgeries?
We have wonderful surgeons in our town here. That's one of the things that we're blessed with. It's really excellent. And because we can do 3D imaging and because we can use SureSmile, we can take cases that used to take 2.5 years, 3 years, and do them in 8 to 10 to 12 months. Because we can figure out where the teeth are going to fit before the surgery, and then I can make the teeth fit that position so that all the surgeons have to do is make it all line up according to the dimensions of how we moved everything.
So with all of this advanced technology, it really eliminates what guesswork there was, and enables you to really speed up the process.
Yes, it speeds it up tremendously. It's funny, one of my patients recently is going to have surgery down at the IU Med Center due to the insurance situations.
Right.
And I told them that they would be ready in August to have it done, and we just put the braces on not too long ago and did her SureSmile scan and get everything ready. And the oral surgeon down there said she's not going to be ready for at least 8 to 10 months. And so we're in communication now, and I have to educate him on what we're doing now that's so much different, because traditionally what you try to do is make all the top teeth straight, make all the bottom teeth straight, and then fit them together the best you can. But now I don't even have to have them fit together because I know where they're going to finish up, and I've got all the wires in order to let that happen. So as long as they put the jaws where I tell them to put them, then finishing them up is much more direct, much easier.
That is unbelievable.
That's pretty cool.
Wow. I'm amazed. If you or someone you know and love, maybe your kids, need some orthodontic work done, I highly recommend Dr. Cohen, who is really on the cutting edge with technology here in Fort Wayne, and can take a look to make the process as easy and as quick as possible, even if that includes surgery. So thank you so much for having me, Dr. Cohen. I really appreciate it. I think what you're doing is just great. So if you are looking for a beautiful smile, but more importantly, a functional, healthy smile, give Dr. Cohen a call and see what he can do for you.